This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Coming up this morning, we'll be talking about obviously, radiation oncology. How does it work? What is it? How is that therapy all used? But before we get into all of that, I think this is your first time in on the show, isn't it? Is it not?
I've been in town less than 3 months, and I'm again excited to be here.
Less than 3 months, and Emily's already making you come over here and do this show, huh?
She gave me this wonderful opportunity. That's how I look at it.
Well, tell us a little bit about yourselves. Where are you coming from then?
Well, I actually grew up in a town, a small city, probably a little around the size of Morgantown, maybe a little larger, maybe a little smaller, Florence, South Carolina. It's where I-95 and I-20 meet.
Yeah.
Our claim to fame is halfway between New York and Miami. Halfway between New York and Miami.
That's funny. Well, welcome. We're glad to have you.
Oh, glad to be here.
So how do you end up in Morgantown at the Mon Health Cancer Center?
It is somewhat of a long story, but
we have time.
I trained in the Metro Detroit area and was with the University of Michigan for a decade. And the University of Michigan is in Ann Arbor. And I, at that time, understood the plethora of advantages of living in a university city. And my introduction to Morgantown, strangely enough, came around a decade ago when I would drive my daughters from Michigan to Howard University. And if you take the southern route, there's a big advantage to that, in that you miss all the Philadelphia, Baltimore truck traffic. So it's about 20 to 30 minutes further of a drive, but it's 20% of the trucks take this route. So it just made sense. And then so I passed by Morgantown. I said, a university city. And so I understood, how Charlottesville, Virginia was, and Clemson, Tuscaloosa, Madison. I've heard great things about all of them, including Ann Arbor. And then a good friend of mine, a guy by the name of Gil Johnson, he had a Ford dealership 15 years ago in Saginaw, Michigan, where I was, practicing. His previous dealership, Morgantown, West Virginia. Yeah, and a few people that I've met, a few people that I've met in Morgantown remembers him, and his son, I think, is a freshman in college, and his son was born at Mon Hospital. So he had a number of great things to say about Morgantown, and as I looked for warmer climate, believe it or not, I had a recruiter to contact me and say, well, what about Morgantown? I was like, I know where that is. And that's a university city. And I said, we can talk. And I visited, and they made me feel very welcome and still have.
See, that puts it in perspective. Compared to Michigan, warmer climate down here, right?
And I'm a numbers person, and it is classically 10 degrees warmer.
Wow.
And I'll take it.
All right, you know what?
I'll take the 10.
Remember that in January, Sarah. Remember when we were complaining in January? We could be in Michigan right now.
You could be in Michigan with a wind chill of 40 below zero.
Oh. Nope.
Wind chill of the last 5 to 6 winters, 40 below wind chill for several days. But that was unusual for Michigan because I've been in Michigan for 33 years. But the 40 below sent a message to me.
Oh, yeah.
And my daughters are adults now, and they weren't coming back to Michigan. They're in different parts of the country, so that allowed my wife and I to be nomads.
Yeah.
And there it is.
Go wherever you want now. All that freedom.
Well, that's what America's all about.
Yeah.
Everybody's a free agent.
That's right. That's exactly right. And that's how we got you here.
Yeah, and it's been a great transition. The community is a kind, conscientious, educated, and courteous community.
So, how did you choose oncology when you started started practicing?
Yeah, that's another story, and it started, believe it or not, in 1963, when my hero, my family practice doctor, bought me a vanilla ice cream cone.
Oh,
really?
Yeah, I'm a stereotypical greedy little boy, and I still remember that huge ice cream cone. He bought it for me. He became my hero. And so flash forward, I'm 11 or 12 years old. He says, boy, you should look at radiology like my son. My son's a radiologist.
You said, okay.
I have my dad's personality, very strong personality. My hero spoke to me.
Yeah.
So flash forward to age 19, I'm in Knoxville, Tennessee, which is 400 miles from my hometown. And I read this article, USA Today article, and it was about radiology. And I thought, holy smacks, Dr. Beck hooked me up. This is amazing.
Yeah.
And that was the final straw on me knowing what I was going to do.
So since you were 19, you've been set.
Hardcore. And again, my dad has a very strong personality, and I do as well. And once we make up our mind, unless we decide to change our mind, that's it.
Right.
Well, coming up on the other side of the break, we'll let you explain a little bit more about radiation oncology, how
Sure.
it work, what the therapy is, all of the above, and a little bit more as well. We're visiting with Dr. James Frederick Littles, radiation oncologist at Mon Health Cancer Center. We'll continue as Mon Health Talk continues on WAJR. Dr. James Frederick Littles, radiation oncologist, joining us in studio. He's from the Mon Health Cancer Center this morning here on Mon Health Talk.
And, now let's get into some of the nitty gritty. I feel like we've gotten to know you a little bit, which you're clearly one of those personalities, easy to get to know.
Yeah.
Which is really nice to have in a physician.
My dad was an extrovert, so this is his personality as well.
So let's talk about radiation oncology. For folks that are listening that are going, wow, I have no idea what that means. Summarize for us, what is radiation oncology?
Sure. Radiation oncology, quite simply, is treating cancer patients with x-rays. Medical oncology is the specialty of treating cancer patients with chemotherapy. And chemotherapy goes all over the body. Radiation just hits the target. So like hunters or military people or people who use firearms, they're hitting the target. And what I do every day is hit the target, which is the cancer and the surrounding areas with radiation.
Okay.
And go ahead.
No, I was just going to say, so I think this is where you're already going. I can kind of feel it. So explain to me how that works then.
Yes. Yeah, we have a multi-million-dollar machine that we program and position to treat the cancer and spare as much normal tissue as possible. So in radiation oncology, I like to say when I treat my patients every day, I'm not in a hurry. I'm in a perfect, because you want to hit the cancer and the surrounding areas perfectly and spare all the normal tissues as best you can. That's why the field of radiation oncology requires a plethora amount of teamwork, because I can't be at every place every day, and there's technical staff that treat the patients based on my programming the system and doing what we call treatment volumes designations, and their physics staff and dosimetry staff that run the angles of the machines based on what I program, and there's a technical staff that actually treat the patients based on how I've programmed the system. And then there's nurses that assist me in managing side effects. So it is very much a team approach, different than the captain of the ship as a surgeon would be. I may be the captain, but everyone else runs the ship. And it's very much analogous to an orchestra. And I was a musician in high school and college. So I'm conducting the band, but I'm not playing any of the instruments. So I know what should be where and how, but I rely on the technical staff and support staff to carry out the mission. So I cast a simple vision, and at Mon, there's a talented group of people that I work with, and I'm really happy to be there. And it's a smooth orchestra group.
So as you're planning out the treatment and as you're talking about you come up with what that picture looks like, and then you can kind of pass that on. How do you do that part? How do you meet with a patient and then come up with a plan?
Well, I get a referral classically from medical oncologists or surgeons, and I take quite a long time to study their history, their x-rays, their pathology report, any laboratory values that they have. And for example, when I treat a breast cancer, whether it's right or left or post-mastectomy, I've looked at the mammograms. I know, of course, which breast to treat, whether it's the right or the left. I know where the cancer was taken from. And I have a long, detailed, comprehensive discussion with the patient, take a lot of time and answer all their questions. And one of the things I tell the patients when I initially see them, if they leave my office confused, it's my problem.
Mm.
So I try to take a lot of time with the patients and answer all their questions. And because what I've learned is that questions elevate comfort level. So once I've answered all their questions and I let them know where they have any additional questions, or write them down the next time I see them, then they sign a consent form, and then I set them up classically a week or two later if they're well healed from their surgery. And then when I set them up, it's almost like getting measured for a tailored suit. So no two women are alike. All setups are customized and tailored. So that takes about an hour, and the technical staff make the measurements, and they put it in a treatment planning system, which is a computer-based system. And I draw out the volumes of the target, and then the dosimetrists and physicists plan the target. And once everything is planned, so from the time of simulation to the time of first treatment, it's classically a week. And that week is a detailed week that the technical staff is making sure that things are planned absolutely perfect. And once things are planned perfectly, I sign off on it. The technical staff calls the patient and says, we're going to set you up. We're going to start you this Monday or this Wednesday. They come in, and that's the initial kind of dry run. It's like you try on your suit there.
Mm-hmm.
And so once you try on your suit and the suit fits perfectly, we turn the machine on and begin treatment.
Wow, it is amazing.
Well, how much more precise are the treatments now versus when you got into the field?
Oh, well, not only that, over the past 10 years, things have changed. So that's the fascinating thing about medicine, just like cars, just like computers, just like radio, just like telecommunications. We're all in constant motion. So what I did 15 years ago is clearly outdated now. What I did 30 years ago is very much outdated now. So things are very dynamic, and if I'm not reading, I'm falling behind, and I'm doing my patients a disservice, and that's not why I'm here. I tell all my patients quite simply, I really do care for you, and I was fortunate that my parents were very caring educators. So caring is in my DNA, so that's why I take a lot of time on the initial consult, answer all their questions, and I'm real meticulous about the setup, and I make sure the technical staff knows that we are not in a hurry. We're in a perfect, which is a different mindset.
We're talking to Dr. James Frederick Littles, radiation oncologist at Mon Health Cancer Center. We'll continue the conversation on the other side of this break as Mon Health Talk continues on WAJR. Got a couple of minutes left with Dr. James Frederick Littles, radiation oncologist at Mon Health Cancer Center.
And, because we have a couple minutes left, I want to get right into talking about some of the benefits of using radiation treatment for cancer. You were talking about being able to get right in there and avoid some of those other tissues. Is that the main benefit, or why radiation over other treatments?
Yeah, one of the big things that radiation oncology has been a benefit over the past 10 to 20 to 30 years is what we call organ preservation. So if you have prostate cancer, you want to keep your prostate, you can have your prostate radiated instead of taken out and still live as long. You have larynx cancer and you want to be able to talk for the rest of your life, so you can sometimes have chemoradiation instead of a laryngectomy. Breast cancer. There's been a lot written in the literature starting in the 1980s that women can keep their breasts and not risk their life. So those are the big advantages, and anal cancer as well. That came out, I think, in the 1970s, where you can, not have a bag for the rest of your life and do very well with chemoradiation for anal cancer. So organ preservation is big. Also, palliation. Palliation, sometimes, unfortunately, cancers can spread to bones, and you have a tremendous amount of pain. And use radiation in combination with steroids and narcotics to help people with pain. And there's an 80% response rate when patients have cancer-induced bone pain, and to get what we call palliative radiation.
So who is a candidate for this type of treatment, and do folks need a referral?
Well, I think most of my patients come to me from referrals, although some just call and want to get what's called a second opinion. And I would say that second opinions are always good, and questions are good. So a lot of times patients will be referred from different parts of the state and also from Morgantown, and generally referred from surgeons, primary care doctors, dermatologists, and medical oncologists. or some patients will, when I was in Michigan, have heard of me and wanted to call and knew me from the community and just called and wanted to come in for a second opinion. So those type situations we welcome.
Got about 40 seconds left. What's the most important thing to take away from our conversation today?
Well, radiation is an excellent modality for definitive cancer care. I have to put in my 30-second spiel on stop smoking, get your colonoscopy at the proper time, mammograms, and vaping is extremely dangerous because no one's controlling or no one cares about what you're using in the vaping. So vaping is extremely dangerous. So stop smoking, mammograms, colonoscopy, and vaping is very dangerous for our young kids.
Of course, Sarah, you can get more information, find out more about Dr. Littles as well. You can head over to monhealth.com/cancer. And, of course, check out the Mon Health Facebook page as well. You're welcome, Emily. Thanks for stopping by. Come back anytime.
My pleasure.